There are tight spots, and then there are tight spots. You may be required to enter the industrial equivalent of a tight spot, commonly known as a confined space. Confined space procedures. This video is to be used to form a basis for your training. Any questions should be directed to your supervisor for clarification. First of all, we will cover 5 general operating and safety guidelines. Number 1. A confined space is an area that meets certain criteria set out by Occupational Health and Safety Regulation 9.1. Note, when a person's head is inside a confined space, even if they're just looking inside for a brief moment, that person is termed to have entered the confined space. Number 2, there are 3 hazard assessment levels for confined space as defined by the Occupational Health and Safety Regulations. Low hazard, an atmosphere known to contain clean air prior to entry and not likely to change during the work activity. Moderate hazard, where clean air is dependent on ventilation, where failure of the ventilation system or respirator will not be likely to impair the ability of the worker to escape unaided. And high hazard, where failure of the ventilation system or respirator will expose a worker to risk of death, incapacitation, injury, or acute illness, or otherwise impair the ability of the worker to escape unaided. Number 3, atmospheric testing or gas testing is performed once all gases are sufficiently purged from the space. The space is checked for impurities as well as for oxygen deficiency and enrichment. If the atmosphere is different inside compared to outside, find out why, and then take steps to correct the difference. These acceptable gas testing limits are for 12-hour exposure. The type of gas testing required and their limits are printed on the Confined Space Entry Permit Atmospheric Testing sheets. If the space does not meet the gas testing requirements, a sign indicating "Do Not Enter" must be posted. Once it's safe to enter, it will be replaced with an Entry Permitted sign. Atmospheric evaluation sheets with the recorded test results will be placed directly outside the entrance. For further information on the proper procedure for air testing, refer to the Personal Gas Monitor video. Number 4. The duties of the standby person are proportionate to the hazard level of the space. For a low hazard, there must be a continuous means to summon the standby person, radio for example. The standby person must check on the worker at least every 20 minutes and must have a means to summon rescue personnel immediately. Moderate hazard, in addition to the duties for a low hazard space, the standby person must be stationed at the entrance to the space and must visually observe the well-being of the worker or workers inside the space, as often as may be required. High hazard, in addition to the duties for a moderate hazard space, the standby person must continually monitor the condition of the worker, prevent entanglement of lifelines, be able to summon the worker from inside the space, and be equipped and capable of immediately rescuing the worker. Number 5. Isolation procedures. The confined space entry checklist sheets will record the location of isolation points and the appropriate method of isolating. Isolation of the confined space will be made as close to the space as possible by qualified personnel. Now that we are familiar with the terminology, let's see how the confined space procedure actually works. Before entering a confined space, a job hazard assessment must be done by the production supervisor. Then the following procedures must be followed. 1. Follow the established confined space entry checklist located in the computer under Lockout.